In this episode, I answer a question from a massage therapist in Ohio who is trying to determine which type of provider to refer a client to when they aren't getting any results from the treatment. I cover the following in this episode. Is the client not responding to treatment, or have you not fully identified the problem yet? Why I would never refer a client to a chiropractor who only does just adjustments. Why I would never refer a client to a PT that just does exercises and stretches, and how to get better results for your treatments by thinking more and doing less treatment. I hope you learned something new and enjoy the show. Welcome back to the Soft Tissue Treatment Revolution podcast, where we teach overworked manual therapists a new injury treatment system that eliminates the frustrations of not getting consistent results, allowing them to cut their treatment times by at least 50% and easily double their income. If you're new to the show and you have no idea as who I am, my name is Dr. Matt Maggio, and I got my degree in chiropractic well over 14 years ago, but I've never performed an adjustment in practice and focused my treatments solely on doing quality soft tissue-based work, and believe that the best and safest treatments in the world to fix injuries and help people get out of pain are soft tissue treatments delivered by world-class manual therapists. Thanks for stopping by and checking out the show. All right, so I got this question on a call with a manual therapist I mentor from Ohio. The question was, been treating client going on 3 months with a chronic neck and shoulder issue that seems to do better for about 3 to 4 days after treatment, but then all the pain comes back, and feeling stuck that I'm not doing anything to help them, and was looking to make a referral to a more advanced provider like a PT or chiropractor. Which one would be the better referral to make to help this client get some relief that I just can't seem to be doing myself? Thanks for the question. Just a quick reminder, show is fully Q&A format now. So any questions you might have, please submit them. And if I think my answer can help or give you any insight or, point you in the right direction, I'll get an episode out to you. All the information to do that is in the description of the show or wherever you're consuming the video. So let's get right into it. Let's just start with some mindset stuff. I tend not to be a huge mindset person or manifestation person, but you really got to stop with all this weak stuff and negative thinking that you can't help. What are you actually doing to get better, to improve all this? I mean, that might sound harsh, that might sound mean. I don't know what it is, but we live in a snowflake society where you can't say anything and everyone's offended. But just because you maybe took some weekend course or some certification and think that you got it all figured out at this point and you're going to fix complex problems, like, no, it's just not going to happen. It's hard. It takes time, it takes dedication, it takes focus, it takes effort. Repeating courses over and over again until you get so damn good that you can do it blindly and that you're just the best at what you do. But mediocrity is come full circle in society, and a lot of half-ass efforts going on out there. So my question first is the client not responding to the treatment, or have you not figured out the problem completely? I get this a lot, especially in the massage therapy world. I tend to see a lot of those people that do my trainings and talk to me and converse with me on the internet. They get this idea where they kind of cop out of being able to accurately diagnose the problem. They say, well, legally, we can't diagnose, so why would I even bother doing that? Like, you got to know what's wrong with the client if you're going to actually fix it. Just another context. I got to give this in context too, because I get a lot of people that at me about all sorts of dumb things. But this is for someone in chronic pain, a chronic injury, not someone that's just trying to relax or recover. This is for like solving a complex problem. When I'm talking about this and everything that I do, you can see it's called the Peak Injury Treatment Method. My clinic is called Peak Injury Solutions. We have a very strict focus and avenue that we work with. It's people in chronic pain that want to get the problem fixed naturally without medications, injections, or surgeries. There's a lot of power to thinking critically. Most people don't want to think about problems. I'd say half of my battle when I'm trying to figure out what is wrong with the client is thinking critically and figuring it out. So my process is very detailed and focused. So first off, we start off with like taking a very thorough and in-depth history. We ask 12 very specific questions about what's going on and really trying to formulate an idea of what is causing the pain, where the tissue is, the history, everything like that. We don't just have them come in and say it hurts here and we jump right into treatment. We got to think critically, figure stuff out, get ourselves in the right mindset and the right thinking so we can actually figure out the problem. Another thing that I like to teach, and I've done with myself over the years, is first understanding the importance of being a clinician first and then a technician. So many of us as manual therapists, we want to jump right into treatment without really having a plan as to what is going on or really know what's happening. And you're like, oh, well, I treat the fascia, so I'm just going to treat all the fascia. Or I do cupping, I'm going to do cupping. Or I do myofascial release, I'm going to do that. Or I don't know, whatever you do. You're not really thinking. You're just kind of being like a monkey and going through the motions. We're like, do this, do this, do this. When it doesn't work, oh, didn't work, need to refer it out. It's like, do you even know what was wrong or what was causing the issue? So many times, we just want to find that one magic thing that's going to fix everything when it's really just a combination of a lot of things presenting. And lastly, don't come at me with, I can't talk. Don't come at me with this intuitive healing nonsense. I hate that. I see it all the time where it's like, oh, I just can tell by the way the client is walking or what their tissue is telling me, and I can feel it. I can intuitively feel it. It's like, get the hell out of here. You ain't intuitively anything. Like that's just nonsense. And if you're one of those people, I'm sure you don't like my stuff. You don't like what I have, and that's fine. I really don't want to talk to you because I think you're a moron. So why I would never refer a client to a chiropractor that only does adjustments. Talk about this all the time. I got my degree in chiropractic. I spent, I think, like $150,000 on it. I got a lot of good things out of it. Really good anatomy program, really good physiology program. I learned a lot about the muscles and the nerves and all that. But for me, the adjustment doesn't actually get to the root cause of what's going on. It temporarily feels better, but doesn't actually fix anything. And I started questioning this a lot, like halfway through school. I've talked about it a lot in past podcasts. If you want to go down that whole rabbit hole of like a chiropractor that doesn't do adjustments, oh my gosh, blasphemy. It's not. At the end of the day, started asking questions. And the teacher told me in one of my classes, like the bone goes out of place, you put the bone back in place. My question was, well, doesn't the ligaments and the soft tissue and the fascia and the muscles hold it in place? Why don't we fix that so that the joint doesn't keep going out of place? And the teacher told me that I didn't believe in the healing powers of chiropractic, should probably drop out of school and all that. Well, I'd already gone halfway through my training. I already put a lot of money in. So really doubled down on the soft tissue work. And I really believe that the soft tissue work is what people need to fix chronic pain. Anyone can do an adjustment and make you temporarily feel better, but it's not going to fix a long-term chronic issue. So what does it temporarily feel better with an adjustment? Very simple. In your spinal cord, you got this pathway called the lateral spinal thalamic tract. Two things travel up there, vibration and movement, and then pain. When you get an adjustment, causes those vibration and movement things to kind of go crazy, blocks some of that pain temporarily, has better range of motion, better feeling, improvement in symptoms and all that, but didn't address the actual dysfunction in the tissue. So it comes back. Just quick pause for an ad break. Are you frustrated with not getting consistent results for your clients who are injured and in pain? Are you on the verge of burnout and feel like you're just stuck going through the motions in practice? Ready to try something new that eliminates the frustrations of not getting consistent results and allows you to cut your treatment times by at least 50%? Then click the link in the show notes or wherever you're seeing this to get full access to our advanced neck and shoulder training course, and also get 8 CU credits for free with no strings attached. Information to do that is in the show notes or wherever you're consuming this. Now back to the show. So why I would never refer a client out to a physical therapist that just does exercises and stretches. Let's be honest here. Sometimes physical therapists are the most annoying people on the internet when it comes to injuries and talking about injuries or having discussions. They're always like, where's your research? Where's your double-blind, placebo, triple-blind study that proves that all of this works? Because I need validation that what I'm doing is working. And what they don't understand is that a lot of research in musculoskeletal treatment is very biased. And it's a lot of times it's done by people that aren't very good at the treatment themselves. They're done in like a university setting where they might be like a second or third year student. And it's really hard to isolate like one thing. So all these studies come out and like basically like, oh, soft tissue work doesn't work. You need superhuman strength to break down fascia. It's all just a big trick you play on the body. But a lot of us that are out there in the real world, working in practice, working in a clinical setting, we know it works. We see it with our own patients, our own clients, and everything like that. We're not going to sit around and do research all day just so we can win an argument on the internet. Next thing is the tissue isn't healthy. It needs a manual approach. So the number one cause of decreased flexibility, pain, and weakness in the body is an accumulation of what is called adhesion, also known as scar tissue. It gets inside the muscles with repetitive use, injuries, trauma, poor diet, poor movement, and it makes it really hard for everything to be able to stretch and move how it's supposed to. Eventually, it gets stuck to nerves, causes a lot of issues as well, and causes nerve entrapments, which present with biomechanical distortions, postural distortions across the board. I could just go on and on and on about all of that, but I won't bore you with that. So the tissue isn't healthy. So the PTs look at it as it's tight and it's weak. My question is, why is it tight and why is it weak? It doesn't need to be stretched. Doesn't need exercise. What it needs is a manual approach that goes in there and identifies the adhesion, gets proper depth on it, proper tension, has the client go through a full range of motion. As you break down that adhesion, which restores blood flow, oxygen to the area, the muscle starts functioning better, starts moving better, and creates a long-lasting pain relief and function. Now, most PTs are not good at soft tissue care because it isn't really emphasized in their curriculum, in their training, and I don't blame them for that. But I do wish that sometimes they would shut up about the rest of it and be like, oh, soft tissue just doesn't work, and where's your research? It's like, it's not that it doesn't work. You might just suck at it, and that's okay. I suck at teaching people how to do corrective exercises and breathing and all that kind of stuff, but I'm really, really good at finding and fixing adhesion. That's all I do all day long. So I would refer to a PT, and I do work with local physical therapists in my own market. Once I get all the tissue cleaned up, I remove the adhesion, remove the nerve entrapments, and things are like functioning, moving better. That muscle's still really weak. And that's where building back up the strength with corrective exercises and movements and patterns is really, really good. But if they're trying to fix a dysfunctional tissue with exercises and stretches and not using a manual approach, it's never going to actually get better. That's why I avoid a traditional physical therapist in the beginning. And they definitely shouldn't be the first person a client should see, but I think there is value in seeing them once the tissue is cleaned up. Lastly, how to get better results for your treatments by thinking more and doing less treatment. First is slow down. Don't always be in a rush. You get a new client that comes in, you have them fill out some 2-page questionnaire that you don't even look at. You just get them on the table and you just kind of feel around and see what you can find, because you want to be one of those intuitive healers, which I can't stand. Don't do that. Slow down. Next is ask questions. Figure out what's going on. Think critically before you get in there. Be that clinician first, that technician second. Then, based off of those questions and those ideas, take some time to think about it. Like, what could it be? It isn't just always a soft tissue problem. It might be a problem with the joint. It might be a problem with the cartilage. It might be a problem with the disc. Anything. There's a lot of different things that can present in the pain presentation that need to be addressed for. Then you're going to be able to do some testing and measurements to know exactly where that is getting caught up. You're not just guessing. You're not treating the whole muscle. You're able to isolate exactly where that adhesion is, where that nerve entrapment is, and get in there, get some depth, get some tension, have them go with the range of motion, and get that problem functioning good. And as you do that, you're going to palpate slowly, not being a rush to just want to do a bunch of treatment, but finding the right type of treatment. I always talk about the difference between like a sniper approach versus a shotgun approach. Most manual therapies are very shotgun approach. Just try a bunch of stuff, see what happens. You never know what's really going on. What I like to teach is more of like a sniper approach, where we get all the data, we line it up, and we go in and get the tissue that is the worst and get it fixed as quick as possible, and then get the client out of there. So we're not beating the hell out of them for an hour, 2 hours. We're allowing that tissue to heal in between. Then when you're done with the treatment, you're going to recheck the test after the treatment to see if it actually made a difference. If it did, you should see an improvement in the test. Now, the next part is really key. You should start the next visit with those tests to see how much of that it has held and if it's actually making progress. Because at the end of the day, treatment should be 3 things. It should be safe, effective, and durable. Most manual treatment is safe and effective to feel better, but durable is where it actually lasts. And if you're actually making a real change in the tissue by eliminating the adhesion, the nerve entrapment, and functioning better, you should see that that test continues to improve. The tests give you what's called objective data, not just subjective, like, hey, how do you feel? It's actually getting to the root, and you're making progress. I always stress this idea of like, think about function first and then symptoms. I always say if things don't move, they must improve. as things start moving better, they're not going to feel better right away, but we're making progress in there and making that sustained progress as well. That's how you get those long lasting results. And here's the thing, I teach you all of this in the free training. In the free training, I'm not trying to make like a shameless plug for that. It teaches you everything from start to finish, what questions to ask, what palpations to do, what treatments to do, what tests to do, how to communicate with the client, and really get you into this, like, I guess, description or reputation in your area as like a problem solver and someone that truly fixes problems. That's all I got on the podcast. I appreciate you listening. As I close out every podcast, go out there and be great this week. The world needs access to your amazing treatments so they can stay the hell away from the traditional medical model of pain pills, injections, and surgeries that only make things worse and definitely ruin people's lives. I appreciate you watching or listening, and I'll catch you on the next one.